Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. It's Dr. Lederman, and we're going to talk just in a minute about why standing seems to be better than sitting. But first, David's on the line. Good morning, David. Good morning, David.
Good morning.
How are you today?
All right, how are you? I had a question about the treatment.
Okay.
When there's the cancer, there's like a margin. There's a cancer cell, and then there's normal cells.
Right.
So, when you pinpoint the radiation, do you completely obliterate the cancer, or there always a layer there might be a layer of some cancer cells that are left, but they don't? Do you understand my question?
Yeah, great question. Well, first of all, I've kind of given you the answer because I've told you just a couple of minutes ago that overall we've treated about 20,000 patients. We have the longest experience in America, and our success rate's 90%. Well, if we left cancer cells behind, the success rate wouldn't be 90% because the cancer would just keep on growing, right?
Enough cells for them to,
so,
like the mother.
Right, so when we treat like the lung cancer, or pancreas cancer, or breast cancer, or liver cancer, we're treating that whole cancer. Otherwise, if we left cancer cells behind, we wouldn't have a 90% success rate. So where we aim the beam, we try to hit the whole cancer, and overwhelmingly, 90% of the time, we can stop or shrink or make that cancer go away where we aim the beam for the rest of the life of the patient.
So the margin, so there must be some normal cells that are damaged or destroyed, but they don't affect the body.
That's right. I mean, if you think about, let's say, if you think about standard radiation versus us, and think about chemo, and think about surgery. So let's just say there's a bread box, and the bread box represents your body, and there's a plum in the bread box that represents the cancer, okay? So for the surgeon, they have to go in and remove that plum, the cancer, without hurting the body, and that's the complication, that often with surgery they damage the body. There's death rate, there's morbidity rate, there's mortality rate, and often they even spread the cancer when they remove the cancer. Like, I can give you many examples where the surgeon actually spreads the cancer when he goes in. With chemo in general treats the whole bread box. They treat your whole body when they try to hit the plum, and that's why there's all the side effects. That's why there's a hair loss, the numbness in the fingers, the lowering of the blood counts, the toxicity, and so the whole body limits how much chemotherapy you can get. The whole body often gets some degree of side effects, and also because chemotherapy often only works in one way, the cancer learns that way and outsmarts it and then becomes resistant. With radiosurgery, we're able to focus in and hit that plum. And radiosurgery works not in one way like surgery or one way like chemo. It works in billions and billions of unpredictable ways, so the cancer in general cannot become resistant to it. So you asked about where at that intersection between the cancer and the normal tissue. So at some point the cancer stops and there's normal tissue. Well, we want to treat that intersection because sometimes there's little fingers of cancer that go into the normal tissue. So we do want to treat a tiny bit of the normal tissue around the cancer, and we do. But because we're only treating a tiny bit, it's obviously much better than surgery, which is going in there like a bulldozer, or going in there like chemo. Chemo's like putting your whole body in a bathtub of chemicals. So usually treating that little border is inconsequential. Okay?
Yes, so the equipment that you use, so this is all, let's say the American have radiation equipment, you have your radiation equipment. All yours is imported. It was based on foreign technology. Why is not your type of radiation equipment not generally used in this country?
Well, that's a misconception. And if you go back and think about what Lance Armstrong, who won 7 Tour de France's, and at one time was considered the greatest biker, and whatever you think about him, people would say, well, what kind of bike do you use? And he titled the book, like he titled that answer, it's not about the bike. And it's actually not about the equipment. Now, equipment sellers want you to think it's about the equipment, but it's really not. It's about the mentality and the talents and the experience of the doctor. And let's just say, when you go to the Metropolitan Museum or you go to some other museum, you look at Rembrandt's work or Vermeer's work or Picasso's work, are you sitting there and asking, what kind of paintbrush did you use? No, you don't ask that. And actually, our equipment is American-made equipment, so it's not that we're importing a linear accelerator from Guatemala. No, we use American equipment, a Varian, which is considered the top of the line, excellent equipment. Now, equipment makers want you to focus on the equipment. They want you to buy XYZ. Oh, Mr. Jones, come and have a treatment on XYZ machine. It's not about the machine. It's about the talents of the doctor, the team. There's a whole team that works together. There's physicists and dosimetrists and technicians and nurses and doctors. And it's about a team that puts together a product that best serves the patient. And some people say, well, what's the difference if you were first or not? Well, the difference is we had the vision and understanding to put together a program of body radiosurgery when no one else, not only in New York or New York State or America or Northern Hemisphere, no one else in the Western Hemisphere did it. We were first because we understood the importance of being able to hit the cancer without hurting the surrounding tissues, without surgery, without chemotherapy. So to be first means a lot, because to be first means you have a vision that there's a better treatment out there, and a treatment that can help people that aren't getting help. And that's why we were first, and that's what motivated me to bring body radiosurgery to this country.
But have people trained, the rest of the country, if you're very successful, have people trained under you, set up?
Well, the problem is a lot of doctors and others have big egos. So sometimes what we find is they say they do body radiosurgery. Some don't do it. So there's many that don't do it. And there's some that say they do it, but they don't really do it. And also, unfortunately, doctors who practice radiation get paid by the treatment. Well, part of radiosurgery is to give just a few treatments that are very focused. Well, many radiation doctors don't like to give few treatments because you're paid less. If you give 5 treatments, you get paid a lot less than if you give 50 treatments. So there's a lot of motivation to keep on doing the same old thing. If you were taught to do something and you've done it for years and years, and that's what you were taught, and that's what you're paid for, it's really hard to teach an old dog new tricks. And so usually what I see is, despite the fact we have 20 plus years of experience, most places are still doing the same old thing. And I can tell you that, and that's what the show's about, I see patients all the time getting the same old thing, and then they come to us to try to get out of a PICO, and we often can get patients out of a PICO even though they've had extensive prior treatment.
See. Okay. Thank you very much.
If you have more interest, you can call during the week at the 212 Choices number. We also have a booklet, and we also have a DVD which further explains our work. So I'd be happy to send it to you if you want. Just call us and give us your name and address, and we'll put it in the mail to you during the week.
One more question.
What's that?
I have one more question.
Okay.
Your statistics, are they third party? Who does the data and the research on?
Well, that's a great question. Obviously, if I did all the reading, it would be biased. So we have outside radiologists who actually compare the before and after, and they will tell us, is it better or is it worse? So they're not related to me. We don't pay them. But it's outside radiologists who actually read and analyze this data. And then we present it, like this week was the National Cancer Meetings, and our data, Gil Lederman, went to San Francisco, and he presented our data. And when data is submitted and accepted at national and international medical meetings, it's other physicians who actually read our data and then agree to accept it or not. And we've had multiple studies this year, in fact over the years, hundreds of studies accepted at national and international meetings. So it's not only the radiologists, but it's other doctors nationally and internationally that want our information to be heard.
Is the studies that have been done, the outside, the reports to the congresses, to the radiation congresses, etc. Are they available? Do you?
Yeah, go look on Astro. We just had a presentation this week, so of course they are.
How would I find copies of the?
Well, go online. Go on Astro, ASTRO, Astro presentation. I think the 54th meeting was in San Francisco this week, and you can look under the name Lederman, and you will see one of our presentations. And there's hundreds of presentations around the world over the last 2 decades.
I see. But are they available in one place? In other words,
you want it too easy. Come on. This is a worldwide phenomenon, and I go to Germany and Russia and America and Italy, and it's a worldwide phenomenon. Go online, start there, and if you have other questions, just give us a call.
Thank you very
much. Okay, God bless you. Thank you. We're going to stop for just a moment. We're going to hear from our sponsor. This is Dr. Lederman from Radiosurgery New York. We've been answering questions about radiosurgery and the benefits and how we get our data and how we perform treatment. And these are all great questions because these are very common questions people want to know. We were the first in America to perform radiosurgery. We have the longest experience, and experience counts. We're a private cancer treatment center where we take care of you. We answer your phone calls. It's not a machine. It's not students. It's not residents. There's not someone else. It's the doctor who sits down and will spend an hour or 2 hours, whatever it takes, and get the data and get your questions and find out where the cancer is and give you all the options. Because, as I say, we're happy to talk about all the options. We're not afraid of talking about surgery or chemo because we know what most likely you'll choose. Because most people don't want to have chemo. They don't want to be cut if they can avoid it. If it's going to help them, obviously, we're going to talk about that. We're going to talk about whether it helps them or not help them. But we're also going to talk from the experience of the longest practice of radiosurgery in America. We're going to hear this voice. We'll be back with more questions and news in just a moment. This is Dr. Lederman.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accept it. Call Dr. Lederman at 212 Choices. 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super